What is Ataxia Telangiectasia? Ataxia Telangiectasia, also known as Lewy Body syndrome, is a rare autosomal recessive neurodegenerative disorder. Ataxia refers to poor coordination, and telangiectasia refers to small dilated blood vessels. Ataxia telangiectasia is caused by mutations in the ATM gene, Ataxia telangiectasia mutated, which plays a critical role in DNA repair and cellular response to DNA damage. Ataxia telangiectasia affects many parts of the body. It impairs certain areas of the brain, including the cerebellum, causing difficulty with movement and coordination. It weakens the immune system, causing a predisposition to infection. It prevents repair of broken DNA, increasing the risk of cancer. Key features of Ataxia telangiectasia. 1. Ataxia. Ataxia telangiectasia is characterized by progressive difficulty with coordination and balance, ataxia, typically appearing in early childhood, around 1 to 2 years of age. The ataxia worsens over time, leading to difficulty walking, speaking, and performing fine motor tasks. 2. Telangiectasia. Telangiectasias are small dilated blood vessels that appear as red spots on the skin and eyes, usually becoming noticeable by 3 to 6 years of age. 3. Neurological symptoms. Degeneration of the cerebellum, the part of the brain that controls movement, leads to ataxia and other motor impairments. Some individuals may develop tremors, slurred speech, and difficulty with eye movements. Oculomotor apraxia is the difficulty with coordination of head and eye movement when shifting gaze from one place to the next. 4. Immune system deficiencies. Ataxia telangiectasia often causes immune system dysfunction, leading to frequent infections, for example, respiratory infections. Low levels of immunoglobulins, antibodies, are common, making individuals more susceptible to infections. 5. Increased cancer risk. People with ataxia telangiectasia have a significantly higher risk of developing cancers, particularly leukemia and lymphoma, due to impaired DNA repair mechanisms. 6. Radiation sensitivity. Individuals with ataxia telangiectasia are highly sensitive to ionizing radiation, for example, X-rays, which can cause severe damage to their cells. 7. Other symptoms. Premature aging of the skin and early graying of hair. Endocrine abnormalities such as diabetes mellitus may develop during adolescence or later in life. Developmental delays in growth could also occur. Diagnosis. Ataxia telangiectasia is diagnosed based on clinical symptoms, family history, and genetic testing to identify mutations in the ATM gene. Laboratory tests may show elevated levels of alpha-fetoprotein in the blood, which is a common marker for ataxia telangiectasia. A 5-year-old boy is brought to the office due to concerns about his speech and motor skills. The patient has a history of speech delay, and his parents say that his speech has become more slurred lately. He also has an unsteady, staggering gait that has progressively worsened over the past year. In addition, the mother states that the patient's eyes and head do not move smoothly when he looks at moving objects. Medical history is significant for recurrent ear and pulmonary infections. Vital signs are normal. Physical examination reveals numerous superficial nests of distended capillaries on the face and ears that blanch with pressure. This patient's condition is most likely due to a genetic defect affecting which of the following processes? The correct answer is A, DNA break repair. This patient has facial telangiectasia, recurrent infections, and signs of cerebellar dysfunction, for example, unsteady gait, slurred speech, findings characteristic of ataxia telangiectasia. This autosomal recessive condition is caused by a defect in the ATM, Ataxia telangiectasia mutated gene. ATM kinase normally plays a role in the detection of DNA damage, for example, oxidative injury, through phosphorylation of various proteins, which then halt the cell cycle to allow for DNA break repair. Without this surveillance mechanism, DNA is susceptible to ionizing radiation and prone to chromosomal breakage. Accumulation of DNA mutations also increases the risk of malignant transformation. Neurons are particularly prone to oxidative stress, and the first manifestations of Ataxia Telangiectasia are typically due to cerebellar degeneration. Unsteady gait progressively worsens in early childhood, and patients often display delayed and slurred dysarthrious speech. Impaired head-eye coordination, oculomotor apraxia, is also common. In addition, defective DNA rearrangement in developing lymphocytes often results in cellular and humoral immunodeficiency and recurrent sinopulmonary infections. Diagnosis is often delayed until characteristic telangiectasias, or superficial nests of dilated blood vessels, appear on the face and bulbar conjunctiva at age 3 to 5. Choice B. MHC class II is found on the surface of antigen-presenting cells and presents foreign protein to T helper cells. Defective MHC class II expression, for example Behr lymphocyte syndrome, impairs T-cell immune response and activation of B cells. Patients present in infancy with severe infections and failure to thrive. Ataxia does not occur. Choice C. Friedreich ataxia is due to a trinucleotide, GAA, repeat expansion, affecting the mitochondrial protein frataxin. Mitochondrial iron transport is impaired, leading to progressive ataxia in adolescence, as well as kyphoscoliosis, cardiomyopathy, and glucose intolerance. Immune deficiency and telangiectasia are not seen. Choice D. Lesch-Nyhan syndrome is a disorder of purine catabolism resulting from an X-linked recessive mutation in the gene encoding hypoxanthine guanine phosphoribosyltransferase transferase. This defect leads to severe hyperuricemia and gout. Patients classically also exhibit self-mutilating behavior, chorioathetoid movements, and spasticity. Choice E. Niemann-Pick disease is an autosomal recessive disorder, characterized by defective sphingolipid degradation due to a mutation in sphingomyelinase. Motor neuropathy, for example hypotonia, arflexia, occurs rather than ataxia, and hepatosplenomegaly and a cherry red macular spot are typical. Educational objectives. Ataxia telangiectasia is an autosomal recessive disorder resulting from defective DNA break repair. Classic findings include cerebellar ataxia, telangiectasia, and recurrent sinopulmonary infections.